everybody. I'm Grant Colfax, Director of Public Health. Thank you for joining us this morning. Last month, 66 people died of accidental overdoses in San Francisco, according to preliminary data released today from the Office of the Chief Medical Examiner. This is down about 21% from January of last year, when unfortunately 84 people died. Of the 66 overdoses this January, approximately 80% had fentanyl as the primary cause of death. As we mourn these deaths, the Department of Public Health continues to increase access to treatment services and proven effective medications for opioid use disorder, namely methadone and buprenorphine. These medications reduce the risk of mortality by 50%. Think about that, a 50% reduction in death. Indeed, most meds for other diseases, including diabetes and heart disease, don't come close to that reduction. Yet someone in this country dies from an accidental overdose every 4.5 minutes. Every 4.5 minutes, somebody in this country dies of an accidental overdose. This is a national crisis, and we need national solutions. That's why we here at the department are so pleased to see the federal government recently change their outdated regulations to make methadone more accessible. Methadone is one of the most effective treatments for opioid use disorder, and yet the medication is highly restricted and over-regulated by the state and feds. For instance, practicing physicians can write a prescription for fentanyl to treat pain, but I can't write a prescription for methadone to treat opioid use disorder. Similarly, it is far easier to get a prescription for Ozempic than it is for methadone. Simply put, methadone restrictions restrict life-saving treatment. But thankfully, under new federal rules to be expanded within the next 6 months, some key things are happening. First, patients can now take home doses of methadone, allowing them to start and continue the medication outside of business hours for opioid treatment programs. This lets patients focus on other important aspects of their lives, including jobs and family responsibilities. Secondly, treatment can be initiated via telehealth, allowing people who face barriers to getting to physical clinics to access methadone. Thirdly, more medical personnel, including nurse practitioners and physician's assistants, will be able to prescribe medications at opioid treatment programs. And finally, the feds are eliminating, I don't know who thought of this one to even implement. They are eliminating the requirement that patients must experience opioid addiction for at least a year before receiving methadone. I don't know where that ever came from, it's ridiculous. We are also working at the state level to make methadone more accessible. We are working with the Mayor's Office and Assemblymember Matt Haney to make methadone available in more medical locations. Unlike buprenorphine, right now methadone can only be dispensed from a certified opioid treatment program and not a primary care doctor or at a health clinic. The new state legislation will provide more flexibility. Last week, Assemblymember Haney introduced amendments to Assembly Bill 2115 that will allow access to 72 hours of methadone through other health clinics, such as primary care providers, while the patient is waiting to enroll in opioid treatment programs. This will dramatically improve our ability to meet patients' needs. Nearly 2,250 people in San Francisco are currently on methadone. These changes to federal regulations will provide them more freedom to focus on their recovery. We applaud the local, state, and federal leadership on making treatment more accessible and recovery easier. Easing the burden on people seeking treatment will help more people enter and stay in treatment and save lives. And now I welcome Dr. Hillary Kunins, our director.
Kunins, Director of Behavioral Health Services and Mental Health SF here at the San Francisco Department of Public Health. To reduce overdose deaths, one of our most important tools is to make treatment more accessible. And you have just heard from Dr. Colfax about the important policy changes that are coming at the federal and hopefully at the state levels. Also, for too long, treatment has been stigmatized and siloed from the rest of our care systems. As a result, too few know about the vital impact of methadone and its benefits to reduce risk of dying. So in addition to the policy changes you have just heard about, we are working to both support and require all DPH providers to provide clinics with available SUD treatment information. To do this, we are supporting our providers with standardized information and handouts. We are also supporting our providers by requiring them to attend trainings about substance use disorder treatment. We will hold these trainings quarterly and cover updates to treatment programs available in the city, new evidence-based interventions as they become available, and strategies to engage people who use drugs and at risk of overdose, but who might not be interested in treatment at the moment. We are taking these steps because we want to ensure that all of us, all of our DPH contracted providers and DPH services, as well as other city services, are working together to raise awareness about treatment that's available, to raise awareness about the effectiveness of treatment, and work together to double down on our efforts to get people into needed and life-saving care. I would like to now welcome to the podium my colleague, our colleague Louis Ramos, a veteran counselor and director at one of our opioid treatment programs. Thank you.
Thank you. Thank you, Dr. Hilary Kunins. Sorry if I mispronounced your last name. Good morning, everyone. My name is Louis Ramos. I'm a clinical supervisor at the Opioid Treatment Outpatient Program, also known as OTOP, or we simply call it Ward 93 at San Francisco General Hospital. I have been supporting people with opioid use disorder for more than 25 years, most recently as the site supervisor out of Satellite Clinic in the Bayview neighborhood. I started last May, so I'm like turning almost a year now. So methadone is an extremely effective medication to treat opioid addiction, but the strict government regulations cause burdens and barriers for patients that can be contributing factors to people relapsing or dropping out of the program. Recovering from an active addiction is challenging enough without barriers to treatment. Even people from an active addiction is challenging enough without barriers to treatment. Even people who are highly motivated to stop using opioids can be derailed from a treatment program due to barriers in accessing that treatment. Many patients must come to the clinic every day to get their daily dosing of methadone. It's basically a hassle for many people. Transportation and childcare issues, work commitments, existing medical conditions are all circumstances that can prevent people from reaching an opioid treatment program every day. There are also many people who are depressed, dealing with trauma or PTSD, or experiencing other mental health issues that can make it challenging to follow through without a dedicated team to support them in their recovery. At OTOP, we take a patient-centered, holistic approach to addiction care that offers a lot of support. During the COVID-19 public health emergency, restrictions surrounding methadone treatment were loosened to allow for take-home doses and telehealth. It gave patients more flexibility, and we saw more people stick with the program as a result. So we basically improved retention rates. Restrictive regulations for methadone contribute to the shame and stigma around opioid addiction, which is harmful to people and their recovery journey. We need to make methadone more accessible to give more people the opportunity to recovery. With support, medication, and dedication, recovery is possible for every person. Thank you.
Good job.
We do have some time for a few questions if anyone